Setting it up. All right, good evening, everybody. Welcome. My name is Dan Nelson. I'm the Incident Commander for the Kenai Peninsula Borough Incident Management Team.
Good evening, everyone. My name is Brenda Ahlberg. I am the Public Information Officer for the Boroughs Incident Management Team. Bear with us tonight as we are attempting to stream this meeting via a product called Zoom. If you'll stand by just a moment, I want to see if we're on testing here to make sure that we're on correctly, because I want to be fair to all our viewers, to make sure that they're getting it also on their phones as well as their desktops. All right, we're good to go, everyone. So Dan, thank you for helping us tonight, making this happen. We're having a lot of folks that are asking questions. They're wanting to know, well, firstly, why do we want to stand up an incident management team for this virus? And why? What's going on?
So, boy, what's going on is a bit of a loaded question. Everything's changing day to day and hour to hour, as anybody who's following our news and the events around the country and around the world. So here in the Kenai Peninsula Borough, when we deal with disasters, we have an incident management team. These are folks that are generally borough employees and some volunteers that take additional training and exercise and practice what a response to a disaster is. And those that have been around the peninsula a while know we have wildfires, we have floods, we have some of these things that we tend to be more used to. A pandemic with a virus with this high transmission rate is definitely some new uncharted territory. It's not something we talk about on a regular basis. So our incident management team is designed to bring all of the information together and bring the decision making and the coordination between all of the agencies. So in this particular case, we have government, our cities, our boroughs, our different agencies and service areas. We have hospitals, we have healthcare with the State Division of Health that handles public health. All of those things, there's just an enormous amount of information, there's an enormous amount of coordination, and that's what our incident management team does. So when we stand up that team, we're kind of taking things to the next step and making sure that when things get complex, which I think everybody can agree we're getting to, all of that information happens and we're able to coordinate the decision making and make sure that overall our overarching objective is keeping people healthy and safe.
We're hearing a lot about the president's support of this effort, as well as Governor Dunleavy's support, and of course our local borough mayor, Charlie Pierce. Why is it important that we operate under this incident command structure in relation to the possibility of future assistance?
So when the president came out and has publicly said to us and the nation that the economic impacts and the disruption of our daily life and we know it's certainly impacting our neighbors and our friends. So what happens when those programs start coming into effect, which just happened the other day, is there's a tremendous amount of course, a little bit of bureaucracy, but a lot of requirements of documentation and paperwork and the way we do things and the way these things are managed. So by standing this up now and by switching to this incident command structure, we're not taking our normal elected leaders like Mayor Pierce or Governor Dunleavy out of the picture, but we're making it more efficient for them to help us guide in our objectives and what they want to see, where we have a skilled team that takes place, the actual nuts and bolts details. So at the state level, you see that through the Department of Health and Social Services, Dr. Zink, and many of the others that you may have seen on briefings. Same thing here. On behalf of Mayor Pierce, I act as the incident commander and carry out those objectives. One of the big overarching reasons for that is when that assistance and when the potential assistance both to the borough and to the state. So we take the burden hopefully off of taxpayers for a response, but also our neighbors and friends that may be eligible for some economic assistance, or our small businesses that may have that. Without us going through that process, without us declaring a disaster, which we did this week, and following this process, our residents aren't eligible for that assistance. So we wanted to make sure that we started that process very early. So if there's as much assistance as possible for those that are qualified, we're able to get that here on the Kenai Peninsula.
So it all starts with that declaration. If we didn't put that declaration in, we wouldn't be able to apply.
Correct. It's a legal instrument. It's a bit of a formality, but without that, pretty much nothing else comes after it. So Mayor Pierce on Monday morning said that was the first thing we needed to do. He signed that and through the chief of staff. And then yesterday, the assembly, the Borough Assembly, ratified it for the next 90 days. So that gives us time to operate and to be able to take advantage of those programs. When we get to that 90-day period, we'll reevaluate it.
Okay. So one of the things that is being emphasized in, regardless of workplace or home, your social life, you're being asked to distance yourself. If you can work from home, folks need to work from home. Why is that so important? And what is the borough doing to follow those protocols?
So you've heard it many times, but it is worth saying, many times a day, is that social distancing, that physical distancing. We're trying to stop the spread of this virus. We're finding out new things about the coronavirus every day, but what we know and what seems to be coming out more and more is how easily this virus spreads. And we know that people that have the virus, they may not show symptoms for 2 to 14 days. So even though we feel fine, we're out and we can do our normal things, this seems kind of silly. To help mitigate that spread, it's something called flatten the curve. If you've heard that, we have to be able to stay inside. We have to have social distancing, which is why we're encouraging everybody, if at all possible, stay at home, stay away from other people, prevent that spread. Because what generally happens in this virus, and what we're seeing, is that it's disproportionately affecting people that have underlying medical conditions and older individuals. So when we take that spread and, even to say we might be carrying it, we're not showing symptoms or very mild symptoms, we may give that to somebody that's vulnerable, a family member, a grandparent, whatever it happens to be. So the borough has instituted closures to many of its facilities to help keep the public safe. And in the borough administration building, there's very limited public access to just a few places to conduct business. So we're asking everybody to use the tools that we've provided, whether that's picking up the telephone and calling the borough, mailing in paperwork, using online tools, commenting on meetings and things by online means, or watching meetings from home. That's what we're asking folks to do. And speaking of meetings, we've also canceled quite a number of those. Right now, we want to be cautious. We're going to be very, very conservative. We don't want to take any chances. We want to keep our employees safe, but also keep the public safe as well. And you'll see that most of the cities on the Kenai Peninsula have done the same thing. So all government services at all levels are still available, especially public safety services. So we want to emphasize that your 911 call will still be answered. A fire truck or EMS will still be coming to your home when you need it. And the same thing with our finance department or assessing department or any other department that you might work with at the borough or city levels. But we're just asking people to do that in a little bit different way, not face-to-face right now. And this tool called Zoom that we're using is actually a great example. In just the past few days, the borough has moved a tremendous number of its business online, so we can stay remote and keep safe.
So how is this impacting some of our other services? Are we still going to be able to go to the dump? And is that going to be minimized at all? Are they looking at closing down or restricting hours in those sites?
We have a 3-phased plan for how to implement closures or precautionary measures based around the COVID-19 virus. Right now, we're in that first phase, where we've closed some of those facilities, but again, things like fire and EMS, things like solid waste, the dump, the transfer sites, those will remain open. And you may see some modified procedures in there of how employees work and being able to keep their distance. But we understand those essential services are required to just keep our everyday life running. So There is no intent to close those essential services unless there's a very overwhelming reason to. So for the foreseeable future, of course, you're all going to see the solid waste department, the dump, all of our transfer sites throughout the Kenai Peninsula open. Trash will still continue to be collected by the contractors. Borough business will still take place in just in a modified way. So bear with us. We're making modifications for safety, but those services are still there.
Yeah, good deal. Good deal. So if I were to walk into the Borough building now, what am I going to see if I need to go pay a bill? You're saying you're wanting me to drop it off at the Borough building. And for those that don't know, the main Borough building in Soldotna off of 144 North Binkley Street, they have a huge metal secured drop box, and you can deposit your payments there. There's also the option to make online payments if you have the ability to do so. Is that correct?
Absolutely. So we'll ask people if you need to drop things off to use our drop box. It's secure. Those things will get taken care of, or if you can mail your payments or make them online. But we still do have the ability to come in if you're handling cash. For right now, we do have that ability. So, please expect folks that interact with you for everybody's safety. They might be wearing gloves. We have plenty of hand sanitizer and those things that we ask folks to use as they're going in and out of the building, and really encourage you to use that and soap and water very frequently throughout the day. So you may see the cashier or the clerk's office available. But there might be a little bit more physical distance, might ask you to wipe down the area or be using gloves. And certainly that's nothing personal, but to prevent the spread of this. And there's right now very inconclusive information. There's a lot of different things about how long it lives on surfaces, how long it can live on a piece of paper or another object. So we might handle things a little bit differently just out of that abundance of caution. But we are focused on keeping those areas clean, not only for our employees, but also for our visitors. So really what it comes down to is you can still come into the Borough building, government services are still accessible, but if it's possible for you to do that on the phone or online, please do so. Exercise that option instead of coming in for everyone's safety.
Okay, I'm going to take this a little bit of a tactical pause here. I want to look and see what we have for some comments, or excuse me, some questions here that you might be able to address for folks.
Of course.
Lots of folks really thanking us for supporting this effort. And a lot of folks that are reminding us to use precautions and prevention measures. So folks are definitely reading the CDC requirements that are posted on the state as well as the CDC page. Those that aren't aware, that page, as well as many other resources, are on our blog. While I'm looking at comments, you want to talk a little bit about the unified efforts we're trying to create so folks have one place to look for information?
Absolutely. And some folks that may have been around last summer might see some of them as quite familiar. But, as we talk about the complexity of managing an incident like this and having that coordination there, the same thing, we know that it's hard to find verified information. There's a lot of things out there if you're going to go online or go on television, and there's different opinions and different things out there. So the best way to follow what's going on, especially in the local area, is to follow KPB Alerts on Facebook. If you're watching this there, welcome. And also our website, kpboem.com. Stands for Kenai Peninsula Borough Office of Emergency Management. So if you visit kpboem.com, you're going to get up-to-the-minute accurate information that's being posted from not only the borough, but cities, the Department of Health and Social Services, and all of our partners. And you can rest assured that that information is trusted, it's vetted, and it's accurate. And we'll get that out there just as soon as it becomes available for folks. So encourage you to bookmark that on your phone or on your computer, and also follow us on social media to have those same updates.
I just want to add clarification on that as information officer. One thing that has been real successful in past incidents that we got this directly from our residents is that when we post official messaging from other agencies, whether it's the cities or those participating in this response, whether it's this one or another one, is that when they see those official notifications, we're doing that on behalf of those organizations. We're not speaking on their behalf. And if there's a question that they have, we have PIOs that are assigned to interface with the municipality. So if something comes up, they immediately call the public information officer for that city or for that agency so that they get that question and they can respond appropriately. We're not responding on their behalf. So we want to make that clear to folks. It really is a repository of trusted information for them. While I've got your ear, I wanted to share a couple questions with you. This is a really interesting one that I think is important to talk about. Will emergency services be wearing masks and taking other precautionary items? What can they see or what can they expect from responders right now?
They may absolutely see some additional personal protective equipment being worn by our responders to ensure that their continuity and their safety is assured. So you may see a couple different things if you interact with our emergency medical services, our fire service areas. The first thing is if you call 911 for assistance, you may expect some questions being asked about your symptoms and getting into a little bit more detail so the first responders are aware before they even get to your house or your place of business. And again, they may be wearing masks or gowns, eye protection, those types of things that you may not necessarily be used to seeing them wearing. We are looking at those protocols, and our medical director, who is a medical doctor that governs all of our medical practices, is consulting with us daily and giving us updated guidance on what the best thing to do is. So I would absolutely expect some additional questions on the phone and also additional personal protective equipment. And you will probably also see something very similar if you were visiting your local doctor's office or one of our local hospitals, as well as seeing some additional screening. And this is a good one to point out that if you are feeling sick, if you are having symptoms, please call your provider first instead of just coming to the hospital, coming to the doctor's office, so they can go through and give you specific guidance and also prepare for your arrival.
Good to know. On that note, just for general healthcare questions or curiosities, if you will, 211 is a good number for folks to call to. That number, as well as the 800 number, can be found on our Borough webpage, the kpboem.com. For folks that don't live in an area where 211 works, they can call 800-478-2221. And again, there's resources there available to answer general questions. Another question that's come along that line is, how many tests are available here?
I don't know a number of how many tests are available here. I know that right now, if you are having symptoms or you have some history and you contact your medical professional, they may refer you to a test. Those tests right now, there's no, you may be seeing some things. I think in Anchorage, they've established a drive-through testing facility once you see your doctor if you need a test that they'll administer. We don't have that here, so your medical provider will give you guidance on where to go, and then that test gets sent off to the lab. So I'm afraid I don't have the specific answer, but the CDC and on a federal level has been relaxing guidelines and enabling more labs to do testing. So that testing process is being made as accessible as possible, not only here, but nationwide.
Okay. And going to back to the interagency page, the state's page, coronavirus.alaska.gov has tremendous amount of resources. They link into CDC as well as the World Health Organization website, and may be able to add to those responses for folks that are asking those types of questions. Another question, what is the criteria for moving from a level 2 to a level 3? And I'm assuming that has to do with our continuity of operations and closing facilities. That's the only clarification of that question I have.
Okay. So when we go to a level 2, so level 2 is kind of an enhanced closure, which we're not doing yet. So if we were to go to a level 2 of the borough's continuity of operations plan, we would the borough building would end up being closed to the public. We would move all business transactions online or remote. Going to a level 3 would compel most of our staff to not report to work and keep them home for their safety. And that would be primarily driven by either the governor's order from Department of Health and Social Services, or some other type of fairly substantial quarantine or isolation order. It's not something that at this particular time, again, know that information is changing on an hourly basis, we would expect to happen in this situation. But if we were given guidance to attempt to completely isolate as many as possible, that's likely what happen. I would like to note that if we went to that type of access, essential services such as 911, fire, and EMS would still continue. Those will not be shut down in the borough.
Very good, very good. There's a couple questions in here that we don't have answers to tonight, but we'll certainly respond via comments within the comment strings here. So I won't belabor those that we don't have answers to, but I will say there's another question here about, will the borough meetings be done online? Last night we did that with the assembly meeting. We were able to stream that via Facebook. Thanks to a couple of folks that helped the assembly as well as the attending staff. What did that look like from a physical perspective there, Dan?
Physically, once we had that streaming online, there were just a handful of people in the room. And, what we did is we also had to change the seating arrangement of the assembly. So if you noticed on that stream, they had separation between them and taking some additional precautions with sanitizers and other things. So I think it's a great question. So I think it's the first time we've done a Facebook Live type of stream for the assembly. Of course, you can always view the assembly meetings and all of the meetings they hold on our website, but bringing it to Facebook was able to get a few more people to access it. As far as putting those meetings online, I would say that it's very likely that we will be doing some of that. We actually are meeting about that and finalizing an action plan. So there's a number of regulations and laws that regulate our meetings. Of course, all of our government business is open to the public and has the ability for folks to come and testify. It's that piece that we have to make work and make sure that we're complying with laws, but also we're complying with making sure that everybody has that equal chance. So, folks that may not have a smartphone or a computer or a good internet connection, we don't want to put them at a disadvantage to somebody that may be able to simply just write a comment. So we're working out those details. For right now, a lot of the service area board meetings and other board meetings have been canceled or postponed. The assembly has canceled their next meeting unless there's some urgent business that needs to come up while we work through some of this. Our laws and our procedures are all very much based on a physical room. So it's taking a little bit of adaptability for us to do that, but please keep an eye out on our social media and through the clerks and through the borough website. We'll get that updated and let you know how you can participate in meetings remotely in order to continue to keep business running and have your opportunity to have your voice heard.
All right. Some of the questions we have regarding airline flights and cancellations that are specific to private carriers. Now, we don't have information on that, but what we could take this time to do is remind folks that if they have loved ones coming into Alaska, what do they need to do now for those self-quarantines that are listed in the mandate number 4? Can you talk a little bit about that?
That's a critical mandate as we see. Remember when we started talking about this virus at the beginning of the video, we talked about how easily it can spread. And that transmission rate is something that we're still trying to understand. But with such an easy spread, we have to be cognizant of our households, of our family members, our friends. So if you've got family that are coming in from out of state, it's the end of spring break. A lot of people have vacations scheduled. If they're coming in from out of state, they need to be quarantined. They need to self-isolate themselves for 2 weeks. So remember, that's those symptoms. It could be up to 2 weeks before you show symptoms. So bringing people in from the airport, having them come down. There's some work on screenings that are probably going to start happening. You might see some folks at the airport in Anchorage reminding you of this, but this is a great opportunity to say, isolate yourself. Go directly home. 14 days, have your plan, make arrangements for that, but you need to isolate yourself. And we have to do that to keep our community safe, not only our older population and those that have health issues, but the president said a few days ago that we're really beyond that. It's for the whole community. So these actions are to keep the whole community safe. Every one of us, your friends, your neighbors, strangers, it doesn't matter. It's for the community.
All right. The sun is beautifully shining today. We've got blue skies. We are all trying to do social distancing, trying to work from home, those that have the opportunity to do so. And I personally would like to encourage folks to get out in the sunshine. I like to say all of us are in this together, but apart. And practicing those prevention recommendations are so imperative so that we can say that we certainly did our part to slow the spread of COVID virus. Any closing words for us, Dan?
I think you hit the nail on the head. Is really continue keeping that guidance in mind when you are going outside. Again, have that separation at least 6 feet. But really, the best thing to do here, as the snow is maybe starting to melt this time of year, is let's stay inside. Let's do this for each other. We're going to keep you up to date as best you can, and we'll have our website and our social media. There's a lot of developments happening. Every family's got a little bit of a different situation, so we know that's hard to sometimes plan for, but please do that. And remember, wash your hands, keep hygienic, and let's help prevent the spread of this. So your Borough Incident Management team is working hard to coordinate the information along with all of the other agencies. Some that you may interact with, and some you may never have, but trying to keep up with this and keeping you informed. So we'll be sure to do that. I'm sure we'll be doing a little bit more of these types of things and keeping you up to date throughout the day. So thanks for this opportunity, and definitely be sure and reach out to us if we can answer more questions.
Thank you, Dan. Everyone, you guys have a great night, and thank you so much for tagging here on KPB Alerts here on Facebook. We also have a new Twitter page that we're trying to get revved up. Please be patient with us as we work through our new social media platform to many of us. And as always, go to the blog, send folks that way for the interagency updates that are available to you on www.kpboem.com. Thank you.